I think beauty is all in the eye of the beholder. But for me, beauty comes from the inside. So if someone is healthy overall, again, if they're working out, eating healthy, overall fitness, if that is in conjunction with how they take care of themselves, how they're treating their skin on the outside, it should be a reflection on the inside. So if someone's outside is perfect and then the inside is unhealthy, I don't think that's good. Beauty is a holistic outside and inside together with a reflection of who you are.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Izzy Morgan, a seasoned medical professional with over a decade of experience in the field of medicine, specializing primarily in surgery. As the medical director of Renew Aesthetics, he brings a wealth of knowledge and expertise to the forefront of the aesthetic industry. Izzy's journey in medicine began with a solid foundation in biochemistry, earning his degree from Whitworth University. His dedication to his craft led him to pursue a rigorous 2-year internship in orthopedic surgery in Guatemalan. Building upon this experience, he furthered his education with a comprehensive 3-year nurse practitioner degree from Seattle University, solidifying his commitment to providing exceptional patient care. Driven by a desire to expand his horizons and embrace new challenges, Izzy embarked on a journey of aesthetics by founding Renew Aesthetics. Since its inception over a year ago, the clinic has experienced remarkable growth under his visionary leadership. So, Izzy, welcome and glad to have you here.
Thanks for having me on. Appreciate it, Daniel.
Yeah, so let's start with, how did you first get interested in medicine?
Ooh, great question. I was on a mission in Guatemala, and I was not interested. I was kind of like, I don't really care what I do. And after undergrad area, I was biochemistry. I was like, I probably should do something in medicine. Wasn't quite sure. My friends were going to med school, and they literally were going to Guatemala for a medical mission. And I was like, okay, I'll go help them out. And that was kind of my first introduction. We worked in the emergency department there, and everything was in Spanish. I had no idea what I was doing. And the emergency room kind of got me in there. I saw a lot of things that, most normal people don't get to see, especially in a third world country. And learning Spanish was also a huge learning curve. And I didn't know Spanish. You kind of pick things up after a month. I was there for about a month. And when I got back, I was like, I could see myself doing that. It really interests me because I was literally saving lives there. I wasn't the one doing it, but I was seeing how the providers were doing that. So I was like, I could see myself doing that. So anyways, that was my first exposure. Came back to the States, and then started kind of looking for internships. And then I got into orthopedic surgery. And I was a scribe in orthopedic surgery for about 2 years after undergrad. And then long story, but I ended up getting to school into Seattle University as a nurse practitioner, and then graduated there. So that was like my journey going through to become a nurse practitioner. A long journey, but gosh, that was like 9 years. Too long.
Yeah.
Too long.
Okay. So then you really got your start on the surgery and really the orthopedic surgery side.
Yeah.
What was the, catalyst to get you to transition over to aesthetics?
Yeah. Well, I still work orthopedic surgery, actually. My day job is orthopedic surgery. And I always wanted to have something of my own. And I think aesthetics was a good, I ran into a colleague in Scottsdale, Arizona. Her name's Shelby Sloan. Awesome individual. She's taught me a lot. And I literally was talking to her about it, and she was kind of saying how she really liked it. And then I was like, looked at the numbers, looked at my time, started out with a goal of, what the projection should be for me moving forward. And then I just decided to, pull the trigger, see what happens. So now we're here.
Nice. So with your practice that you started up, Renew, what are some of the most common treatments that you provide to your clients and your patients?
So we do, a lot. I feel like a lot of places do Botox. So we do a lot of Botox, but that kind of brings people in the door. I do a lot of PRP, a lot of PRP. I did 2 patients today, and then I did a Botox appointment. So PRP, I do a lot of. I don't have any lasers, but so I'd say Botox, PRP, skincare. We do IV therapy, and then we just started peptides. So peptides are
Okay.
big right now. Yeah.
Okay. So, and I think this is something that's I'm starting to see this trend of medical spas bringing in more regenerative medicine treatments,
Yeah.
more related treatments.
Yeah.
Could you talk a little bit about that? Like why do you? I guess because I think most people think about med spa and it's just purely aesthetic, like Botox,
Yeah.
maybe lasers. So,
Yeah.
why do you think that there's kind of more of this shift as far as more regenerative medicine, more functional medicine, more wellness?
Yeah. Well, I mean, so I always think about the body as like, like a car. Like you can have a beautiful outside of the car,
Mm,
Well,
mm,
the engine is, but you have a little Honda 450 in there. It's like, what are you doing?
mm,
So my whole goal, like besides making, someone look better is actually longevity,
mm,
keeping them healthy.
mm,
Like you can take someone that's just like overweight, you know, all these, cardiovascular disease, all the risk factors, diabetes, and then make their face look beautiful. But if their heart is struggling, it's like, what are we doing here?
mm,
Like
mm.
what are we doing here? Like, why are we making the outside of your skin look so good when your body's struggling? So for me, I think health is number one. After we figure that out, then we can start on the regenerative medicine on beauty. So that's my personal opinion.
Yeah. So really about fixing the inside, and then from the inside, it's going to get to the outside.
Absolutely.
Mhm.
Absolutely. I think that's huge. And I feel like a lot of people don't understand that. So
Mhm. Okay. So then I want to dive a little bit deeper into the regenerative medicine section, since this is
sure.
I call it newer, even though it's been around for a while, but really not so much in the medical spa side. I know that's been
Yeah.
around a bit longer in the orthopedic side. So I'd like to get kind of more your thoughts on regenerative medicine, and let's start with what is it and how can it?
Sure. Well, so regenerative medicine, let's, again, like, so if someone is morbidly obese, right? Their visceral fat or the organs that are in the abdominal region, there's visceral fat that surround those organs. That visceral fat is actually very detrimental to our overall health. It leads to higher sugar levels. It leads to your heart pumping as hard as it can. So that's increased heart rate. That's increased blood pressure. That lowers our actual age. We may be, 40, but our actual age would be like 60 to 7. If someone is like unhealthy and that visceral fat is just suffocating your organs, you're not going to live as long. So like regenerative medicine, I guess to me is just like reducing that overall risk of death, right?
Mhm.
So decreasing that visceral fat, increasing, your cardiac output, decreasing your blood pressure, overall health, which is just really by lifestyle modification, eating
Mhm.
healthy, going to
Mhm.
the gym, the things that we all know how to do that no one like does.
Yeah.
So if I can get my patients on a regenerative medicine like overall health journey, then I think I've won. Even if they're not, paying for the Botox, paying for the PRP, paying for all that, I'd rather them be healthy.
Okay. And you talked about that actual age versus I forgot the word for it, but your real age, I guess your actual age, like whatever the term
Yeah.
was there. So uh for people that are, let's say they're 40 and they're unhealthy, their
Yeah.
actual age may be 60 as far as like the body is concerned. So
Absolutely.
it sounds like you can do this, but for people that are in that situation, can they reverse that? Or is it more just like, oh man, like, okay, if
Oh,
it says
absolutely.
I'm like 60, then
Yeah, we
go
see
back.
it all the time. We see
Okay.
it all the time. So people that, individuals that are, morbidly obese and they have that low cardiac output, their heart is struggling. You can literally take a myocyte, which is of the heart, put it under a microscope. As they're larger, you'll see that the strain of the muscle just working so hard. So the age of that heart is extremely old. But if you take that myocyte after they've lost weight, after they've dieted and exercised, you can actually see the muscle like reverse in age. So
Mhm.
yes, like you can actually reverse your age in medicine.
Wow. Okay. Now, with regenerative medicine, my understanding is I'm taking the blood out of my body and then spinning it.
Are
And
you
then
talking about platelet-rich plasma?
yeah. So
Yeah.
just for people who don't really know how regenerative medicine works, like, is that process kind of how it works? And like, I guess, what's the science behind why it works and why it's helpful?
Yeah, so PRP, really cool. Your blood is comprised of like two parts, right? Your red blood cells, and I guess your platelets. So it's got multiple components. When you take that blood, and we take we have to take a large bit, 60 cc's, and we put it into something called a centrifuge. A centrifuge is a big machine that spins very fast. We can actually separate those two components, or those components, into red blood cells, white blood cells. That white blood cells I can take and put it, extract it from the red blood cells. So then I just have that in conjunction with a counterbalance for that big machine, and we spin it again. So it's a double spin centrifuge, and we take those platelets that are like really condensed, and we pull those up, and we can actually inject that underneath the skin, and it's really good for like scarring. I use it for under eye treatment a lot. I had a guy come in today, and his under eyes were just really hollow, and he was looking to I guess get some volume back. So a lot of PRF, people are using that. It's the same concept. It's just growth factors that are increasing the, I guess, volume that hopefully will increase, or decrease that hollowness of the eyes. We also use it for scarring. And in orthopedics, we actually use it for intra-articular injuries. So like if you had a meniscus tear that was non-surgical, I'll actually inject it into the knee, and that will aid in healing as long as the meniscus tear isn't too big. So yeah, we use it in multiple areas in medicine.
Okay. So I guess the regenerative medicine really earns its name. It's basically regenerating parts of your body using your own body.
Yeah, it's great.
Okay. So because I was always curious as far as the spinning part, like what did that do? I mean, it's still
your blood. Why?
By spinning it, like what does that do? Just by
what does it do? Yeah, it's just separating the components. That's all it is.
And then you're basically taking the best of those components, putting it back into the air so it can basically grow those areas.
Yeah, you take the best, the healing factors of that blood. So you take only the healing factors of that blood, and then our machine actually spins it down again. So it's a very concentrated dose. So from 60 cc's, you got to think that's a lot of blood. We spin that down to half, and you get the plasma from that, and then we spin that down to 7 cc's.
Oh, wow.
So it's like very 60 to 7, and that's what we inject. So it's a very concentrated dose of platelet-enriched plasma, we call it.
Okay. And how quickly, or I guess how many treatments would you typically, like the average person, is it kind of like a one and then you start to see the results, or is it like you do multiple, or is it one and then it takes a couple of weeks? Like what's the time?
So the best results you can get is doing 3 months in a row, 1 month apart. So 30 days, I'll see a patient, I'll do the initial consult. We decide on PRP. Day one, I wait 30 days. They come in at 30 days. We do their second treatment. We wait 30 days. We do their third treatment, right? So that's 3 treatments. Then I'll wait about 6 months, and I want to have another consult with them or another visit. And I want to say, okay, well, how are we doing, right? After that, we can wait. I usually wait about every 6 months. So it's a big dose in the front, and then we'll wait 6 months, and then another 6 months. But usually that gives me the best bang for my buck. It's expensive. So a lot of people, they'll do 1 or 2, and then they'll wait 6 months. But what the research shows is once for 3 months in a row.
Okay. Now, is there really a benefit to obviously you use it using your own blood, but is there a benefit to using somebody else's blood or animal products, or like, can you even do that?
So I wouldn't take someone else's blood and inject it just because the risk is too high. But a lot of research is going into like PDGF. I'm sure you've heard that term spun around, but that's growth factors that are derived from other sources, and they are putting 10 times as many growth factors in this serum. That is a new and upcoming, I guess, treatment in aesthetics. We've had it a lot in medicine for diabetes and like foot ulcers. It's actually FDA approved for that, but it's not FDA approved for any aesthetic procedures. Not to say that it won't, it's just very hard to get FDA approval in our industry. So if it's FDA approved for diabetic foot ulcers, and that's a big deal. So a lot of research is going into PDGF in aesthetics, and I think soon, within like 3 years, I'd say it'd be approved for aesthetics. But that's shown a lot of promise, especially for like treatments under eyes, like what I'm using the platelets for. So that'll probably switch in the near future from blood to that.
Okay. So is the PDGF something that is, for lack of a better word, made in a lab, or is it derived from like an animal? Or
I believe it's derived. I believe it's lab driven, but I don't know if the initial. I'm not sure. I'm not sure if it initially comes from an animal or it's like derived from a lab. I'm not quite sure on that.
Okay. So, but I guess the concept behind it is instead of pulling your own blood and you only get 10% of whatever you're pulling,
Right.
you basically don't have to draw your own blood. You get this PDGF. You're getting, instead of the equivalent of 7,
Yeah.
you're getting 20 or 30 or whatever that is, a lot
Correct.
stronger dose.
Well, a lot of people too, and you'll see it if I have a like an unhealthy individual and they come in and I take their blood, right? Their blood, not everyone's blood is, you know, is equivocal. Like a lot of people's blood is like not healthy, in lack of a better term. So I'll take their blood and the plasma that I get is like already like low. If I like healthy, if a healthy individual comes in, it's like half and half. I'm like, okay, I know I'm going to get a lot of plasma from this, but with PDGF, that's, you already have that growth factor serum. So it's already done. I know what I'm getting, so it doesn't matter. Like if the individual's unhealthy, that I know that this is a very high concentration of growth factors that I'm going to get, which is nice.
Yeah. Yeah. Very consistent at that point. You know,
very
consistent.
What
you're getting.
You know what you're getting.
So that brings up another interesting question I thought about. So you talking about quality of blood. Sometimes the blood is not of good quality. Is that quality of blood really based to your overall health, or is it more just genetic? You have good blood or you don't have good blood?
Yeah, I'm a firm believer that if someone's unhealthy, they've been eating unhealthy, they're just eating trash all the time. They come in to see me, I can pull their blood, and I know immediately like this person is not going to get the results that they are going to want because their blood and their growth factors aren't going to be there. So they may get a little filling effect for a little bit, but they're not getting the best. If an individual's healthy, like the guy I did today, he works out every day. He eats healthy. He's lean. I can tell he's healthy. And when I pulled his blood, I was like, that's a good sample size. Like I know I'm going to get a lot of good growth factors in this plasma. So it's really nice.
Okay. So then I would assume then if someone comes in, they're really unhealthy, you draw their blood and basically, for lack of a better word, they have bad blood.
Yeah.
If they go through fitness, wellness, exercise, can they turn their blood to be good now?
Absolutely. I haven't seen that yet in my practice because it's hard to convince people to start, living a healthier lifestyle.
Yeah.
But yeah, absolutely. Yeah.
Okay.
I could totally see that happening.
Okay. Now I'm curious, I'm sure you get a lot of myths or misconceptions you hear when people come in for this type of treatment.
Sure.
What would you say is some of the most common myths, misconceptions you hear?
Regarding platelet-rich plasma or
anything on the regenerative medicine side?
Oh, anything. Let's see. Botox takes away my wrinkles, right?
Mm-hmm.
That's not true. What I'm doing is I'm injecting a neurotoxin into your muscle that is not allowing the muscle to move. The dent on your dermis is still there. It's going to take a while for that dent to go away, right? That crease in the skin.
Yeah.
So people are thinking, Botox equals no more wrinkles, but it's not. It's kind of like that's a misconception. A lot of in regards to PRP, I think I just don't think people understand what the process is in PRP. So they're thinking, they spin my blood and they're injecting the blood into my places, which helps restore my skin. They're not understanding that I'm taking the plasma, separating it, and then the plasma is going into growth factors underneath the skin where I'm injecting, which is regenerating. So, I mean, the outcome, they're just seeing the outcome. They're not understanding the process, which I guess they really don't need to. They just want to look better.
Yeah. We're taking your blood out. We're doing something, we're putting magic on it.
It's going to make you look better.
Okay. Now, I'd like to dive a little bit deeper more into how you educate your patients on you. And particularly I want to talk about, and this might be a little bit separate from the education side, but men coming in getting aesthetic treatments, because I think that's of a taboo thing, or it's just like not manly or whatever you
absolutely
say about it.
But
how would you approach that, the education side, and then men?
So I educate people how I want to be educated. I mean, because I've noticed for me, I want to know like every detail of like every little thing. And it doesn't matter and like what it is, even if I'm learning about like my car, right? I'm like, okay, this hooks to this and then this hooks to this, right? But why does that happen? Because it needs more airflow. So when I'm talking about, any part of orthopedic surgery, regenerative medicine, Botox, PRP, peptides, skincare, IV therapy, the medicines that go in IV therapy. I think it's good for patients to know, like, hey, this is what I'm doing, and this is why, and this is what it's going to do as an outcome. So,
Mhm.
I think if patients understand the process, then they're more open to the idea, but also they're more educated. So they understand what's going on. I don't want my patients being confused. Like if we're doing, Botox on a patient, even a knee surgery, it's like, well, why am I getting this? Well, this is why, and this is what it's going to do, and this is the outcome, right? So I just educate them exactly how I know the product. So that's number one.
Mhm.
Number two, guys in aesthetics, I feel like that's very taboo. And I've talked about this a little bit in the past on my Instagram, but I have a lot of guys. I see a lot of guys. I feel like a lot of guys specifically come to me because I think I am a guy. So they're like, oh, it's not weird if I go and see Izzy because he's a
Mhm.
guy. And like pretty much none of the guys ever want to be on film. They just are like, don't tell anyone I've been here.
Mhm.
Don't put this on your Instagram. Don't even say my name that I get any cosmetic procedure. I'm like, guy, like I feel like guys should be very open with aesthetic procedures they're getting because you know the girls that I see are doing like so many things to keep up with themselves. They're doing their hair, they're doing their nails, they're getting their makeup done, their eyelashes, their eyebrows, they're getting lip filler, all the skincare, Botox, filler, PRP, IV therapy. I mean, all the things, like all the things. And you don't have to convince them on. They come in, they're asking, right? And then guys are like, should I do this one thing or is it weird or what do you think? It's like if girls are keeping up with themselves and we're not, I just feel like that's so wrong. Like,
Mhm.
I don't know, guys need to keep up with themselves.
Yeah.
So I think it's very good when I see guys come in and like, I want a cosmetic procedure. I'm like, yes, good
Mhm.
job.
More than just a shave, right?
Yeah, at least shave, dude. I mean, come on. Do something.
Yeah. Okay.
Yeah.
So now let's say that somebody's looking for a provider that they feel comfortable with, who can educate them, like you've talked about. Uh,
Yeah.
what piece of advice would you give to somebody who's trying to find a good provider, but they're not sure who to use or even how to look for somebody?
I would just say, just go with who you're comfortable with. If you're going there and you're talking to your injector or your provider, and that includes your orthopedic surgeon, your primary care provider, your aesthetics provider, even the nurse that's injecting you. I mean, it's like if you don't feel comfortable with that person and you can't say how you feel, if you're
Mhm.
like, I don't want to tell them that my eyebrow moved a little bit like this last time, should I tell, like, you need to be very comfortable. You need to go and tell your provider, like, this is what I'm looking for. This is what happened last time. This is what happened with my last provider. Is there something that we can change here? So, I think if you feel comfortable with your injector, your provider, then stay there. If you don't, leave.
Okay. And are there any red flags if someone's looking for a new provider or going for the first time? Are there any red flags that you should keep an eye out for where it's like, okay, like it sounds good, but there's this red flag, so I should be a little bit cautious?
As a provider.
Yeah. Yeah.
Um,
Looking for a provider. Any red
yeah, I
flags?
mean, absolutely. If they're coming in like pretty aggressive or they've been doctor shopping, we call it doctor shopping.
Mhm.
Yeah, I've been to every medical spa here and I didn't like this medical spa and like this one. I mean, we're all colleagues. I'm like, hey, those are my colleagues. Like,
Mhm.
why are you putting down all my colleagues? It's like it's a red flag because I know they're just gonna leave and talk, bad about my practice,
Yeah.
which I'm expecting.
Mhm.
So, which is okay.
Yeah.
So it's a red flag to me. I'm like, but I'm still going to see the patient.
Yeah.
And if they want to leave after that, that's fine. If they don't want to get any cosmetic procedures, I'm fine with that. You
Yeah.
know,
Okay. Now, I'm curious, Izzy, when it comes to uh your role, what role do you believe creativity plays in how you approach your
Ooh,
patient care? Is it
I
because I
like
mean,
that.
it's like orthopedic, especially like surgery. It's like
Yeah, yeah,
you
great
gotta follow
question.
this one path. Else
Yeah.
you're
Well,
gonna kill this
actually,
guy.
it's funny. Everyone thinks surgery is like very like this is what you do, this is what you do there. But there's so many times where you have to, go away from the path and say, okay, that didn't work. What's the next step? How do we, what do you think about, moving to, this option? Creativity, I think that plays a huge role in surgery and in aesthetics because a lot of people are like, they don't have, you know, a structure, like, well, let's say like cheekbones, right? A lot of females come in and like they don't have high enough cheekbones. So they're always asking me, what do you think? And I'm always recommending like, oh, we can make these cheekbones a little higher, right? But you have to have some artistic bone in your body to understand like, okay, we have to like make or create, pretty much with filler to bring this up and fill this out in a way that doesn't look fake, right? So I think, creativity is huge, and some people just don't have it. Some people do. And luckily, for whatever reason, I have some creativity and background in like video editing, and it really helped me kind of, in aesthetics and surgery, of course. With my hands, it felt really good to just like injections. They're like no problem. Like, really can feel that tissue. Like, I've cut through so many skin now and done so many injections that it's like nothing now.
Yeah. Okay.
Yeah. But I think creativity, to answer your question, huge.
Okay. Now, Izzy, I'm sure that throughout your experience, you've run into some challenging cases or tough cases. Is there maybe a story that comes to mind that you can share? Maybe someone that came in, tough case, challenging case, and ultimately how you're able to work through that and get them a successful outcome in the end.
This is for aesthetic practice?
Yeah. Yeah. Or just anyone that kind of comes to mind.
Let's see. I did have a patient recently that that came in with pretty bad scarring. So, as a child, she kind of, picked her face. She had a lot of acne on both sides. So, her big thing was the scarring, and then she didn't have, the high cheekbones that we talked about a little bit. So I really didn't know what to do initially when I saw her. She's crying, and so I said, okay, let's work through this. So I said, what I think we should start with is some microneedling with PRP, and that started helping with the scarring. I lifted her cheekbones a little bit, and then I just did some facial balancing with Botox, and I gave her, or with filler, and then I gave her some Botox, and kind of like overall made her face look significantly, I guess, less scarred than it was before. The confidence that I saw in her was really what was cool. So I think that, like, I guess, was a touching story to me personally, because I was like, man, I saw her like crying, and then like she came in and she's like, the confidence level, like she got a boyfriend, she's super excited, she came in smiling, you changed my life. It's like, that's a cool story, And in aesthetics, you don't see that as much, because like, okay, in surgery I see that all the time, like, oh, my knee, fix the knee, sure, but in aesthetics you don't see that as much. So that's a cool like story from my clinic, I guess.
Yeah, and I think it's also really good because this is the part that I think your average person doesn't think about in aesthetics. They think, aesthetics practice is just about about vanity, and they just want to look like the best. But it's, in many cases, when I ask providers, like, what's the most memorable story? It's almost always of someone came in, they had some type of issue, they felt just not confident, they were not ashamed to go outside, but like they had this big kind of chip on their shoulder as far as like, I feel really insecure about this. And getting them to feel normal and look normal, like that changes their entire perspective and changes their entire life. So it's not about, these people didn't come in being like, oh, I want to be the most beautiful person on the planet. It's just, I just want to look normal.
I just want to look normal. Yeah. Seeing someone's confidence go up, I think, is probably one of the best, things to see in aesthetics. And it wasn't just, confidence. It also transitioned to, hey, my skin looks better now. I look better now. She started going to the gym. She started losing weight. She started becoming healthy. Like, all these things transpired just from like a few cosmetic procedures, which is, I mean, that's pretty sweet.
That's actually pretty incredible. I've never really thought of it that way, because I think
it's usually the other way.
Yeah, it's usually the other way. It's like, okay, like you go get fit, and then okay, now you want to get the aesthetic stuff, but having the aesthetics done first, and that being the catalyst to then wanting to eat healthy, work out. I've never heard that before. It's actually a very fascinating
topic.
That
was cool. Yeah. So that was a good story.
Okay. Now,
I'm glad I thought of that one.
Yeah, that was a really good one to share. Where do you think the future of aesthetics is going?
Good question. Hopefully in a good way. I can see it going kind of in the bad way, which is just like money driven. Everyone needs to look fake. I think I really am trying to tailor my practice to less is more. Look natural more than fake. I hopefully things are looking more on the natural side. Fingers crossed. And then fingers crossed, it's also moving towards holistic medicine. Now we're going towards weight loss, being overall healthy in conjunction with aesthetics. But I don't know if it starts going more towards everything's fake. I would not want to do aesthetics anymore, if I'm being honest with you.
Okay.
Yeah.
So hopefully it's going to go in that direction of wellness. I guess combining wellness and aesthetics.
Yeah, that really should be what the goal is with aesthetics and medicine in general.
Okay.
Yeah.
And with your practice, Renew Aesthetics, what's your vision for your practice?
So we're new. I mean, I just hired. I mean, I've gone through, like, I hired a nurse initially. She's not with me anymore, but we've been about a year and a half now, and it's just been me. And it's really hard for me to go from hospital, surgery center, seeing patients, orthopedic surgery, and then running over to the clinic and seeing patients for like an hour, after clinic. It's just and then trying to stay healthy and even have a life. So I just hired a nurse this week. I think her first day is next week. So I'm really excited about that. My goal is to have practice here, practice in Portland, and a practice in Seattle. So kind of having 3 practices that are running. I have some, multiple partners in Seattle and in Portland that I'm working with to start opening up some practices there. But I think the goal is to have 3 practices kind of running. If it gets bigger than that, cool. If not, cool. But I kind of have a big visions, and hopefully they come into fruition. But I'm excited about the future. So, transitioning out of orthopedic surgery is my goal in the next, hopefully, year to 2 years.
Okay.
And just doing full-time Renew.
Yeah. Okay. Got it. A bright future ahead. Bright vision.
I hope so. Yeah, it's exciting, man.
Yeah. Okay. Well, Izzy, I have one last question for you. But before I ask it, I do want to point people to your website at renew-aestheticstc.com.
Yes.
Now, last question for you, Izzy. What does beauty mean to you?
Ooh, great question. I think beauty is all in the eye of the beholder. But for me, beauty comes from the inside. So if someone is healthy overall, again, if they're working out, eating healthy, overall fitness, if that is in conjunction with how they take care of themselves, how they're treating their skin on the outside, it should be a reflection on the inside. So I think holistically, if they're healthy, that's beauty to me. I don't think, again, we've talked about this a bunch, but how, if someone's outside is perfect and then the inside is unhealthy, I don't think that's good. Beauty is a holistic outside and inside together, with a reflection of who you are.
Well said.
I think, and a lot of confidence comes with that, like our story. So
yeah. Okay. Well, there you have it. Izzy sharing his expertise. So, Izzy, where can people contact you in your practice?
Yeah, our phone number is on our Instagram. It's on our website. You can call that number, and our front desk will get you scheduled. Also, you can go to our website, and of course, we're going to have some openings with our nurse now. So, just schedule however you can, really.
Awesome. Well, Izzy, this is great. Thanks for coming on. Thank you,
Daniel. Thank you. Thanks for finding us. Yeah, appreciate you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.